Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your health. Whether you're looking into preventing disease, managing chronic conditions, or simply elevate your quality of life, Prescribing Lifestyle is here to guide you on your journey to wellness. So, sit back, relax, and get ready to embark on this transformative adventure towards a healthier, happier you. Let's dive in. Hello, listeners. It's Dr. Charlton. I have a guest for you today. I have Dr. Angela Kwong. She is a GP in Sydney. She is a GP that started Enlighten Me. She runs this clinic as a medical supervised weight loss clinic. Welcome to the podcast, Angela.
Thank you, Dr. Avi. Thank you so much for having me as a guest.
Thank you. So you started to run a weight loss clinic. Tell us a bit more about your journey. How did you become a weight loss GP?
Yeah, so I was actually working in general practice for a really long time, seeing patients through all aspects of medicine, probably much like yourself, doing women's health, pediatrics, travel medicine, everything, you name it. And I had an increasing number of patients coming to ask me for help with weight loss. And I found it really rewarding. I found that I was able to kind of help a patient turn their life around at that earlier fork in the road, and we were able to prevent a lot of chronic diseases. So that is what really spurred my interest in weight management. But what I also felt was that weight management was a little bit fragmented in the community. I felt like my role was somewhat restricted to just being a prescriber and a referrer. I felt that when I was referring patients out to a dietitian for a consultation or out to an exercise physiologist for a consultation, it would be weeks or months until we'd be able to communicate and find out how a patient was going. And I really missed that multidisciplinary type care that I was used to being a part of in a hospital team. So that's the reason why I created Enlighten Me, so that I could be part of a multidisciplinary team taking care of a patient through their weight loss journey.
Wow, that's amazing. What's Enlighten Me about? How do you operate?
So I run it as a telehealth type practice. It actually came forward during the pandemic because I found that patients actually preferred telehealth somewhat. And also weight management is something that can be done from telehealth. It's something where patients can actually hop on the scales and measure their weight before the consultation. They can also use a tape measure and measure their waist circumference beforehand. So it is one of those subspecialties within medicine where telehealth is a niche that is quite safe to do medicine. So I did design it as an online medically supervised weight loss program. And in that program, patients get individual medical consultations that are not really very really very different to what they get in the room. So we are talking about doing blood tests to assess a patient's medical status, giving them counselling in regards to medications, giving them individualised nutritional advice. And then in addition to that, the program includes group coaching. So each week, the patients see me and a nutritionist for education. They exercise with us together with the exercise physiologist, and we have an online learning platform where I have a bunch of great educational videos that I've created that has everything that a patient really needs to be empowered to look after themselves to maintain their weight in a healthy way.
That's awesome. That's very similar to what I do. We've got lots of things in similar. I don't have an exercise physiologist and I don't have a dietitian. It's just myself with me.
I started off as a solo practitioner actually. So when I
Yeah, yeah.
first launched it, then it was just me as a solo GP. And I
Mm.
actually had the nutritionist come on as a guest presenter, and she did such a great job that I said, please come every week. And she ended up joining. And then it kind of just, the team kind of grew from there.
That's great. That's awesome. So, what are some of the success stories that you can share with us of your patients?
I've got quite a few different case studies of
Mm,
patients who I regularly share during the weight loss masterclasses. And I
mm,
think one of the most rewarding things as a GP is to actually have patients graduate from your care.
mm,
So, in the past, I've always felt a great sense of care looking after a patient. Patients come to you, they receive care, they get better, but they do continue to come back. Whereas when it comes to weight management, I think when it is done well, when you're able to treat the underlying factor contributing to their weight and you're able to empower them with the skills that they need, they actually have the ability to graduate beyond your care where they don't need you anymore. So, for example, I have patients, a great majority of my patients are women who come to see me because they
mm,
have difficulty with their weight and their factor is polycystic ovarian syndrome.
mm.
And I
Yeah.
think that PCOS is something that is really poorly managed in the community. It's
Mm,
often not well identified by the
yeah.
patients or by the healthcare workers. And even when it is recognised, it's kind of seen as a women's menstrual irregularity rather than as a metabolic health condition. And
That's it.
so patients don't really have it treated from a medical perspective. They
Yeah.
don't really get nutritional or lifestyle support. And then they
Mm,
don't really get that discussion about how PCOS can increase their risk of metabolic disease in the future and have future planning. So to be able to help someone with PCOS improve their health, treat their PCOS, optimize their weight, and have the skills that they need to be able to maintain their lifestyle in the future, such that they graduate from Dr. Angela's care. I think that is something that is incredibly rewarding.
yeah, yeah, fantastic. I've had a patient who was struggling to fall pregnant for about 10 years, and she went low carb, lost a little bit of weight, and then she fell pregnant. That was the most rewarding outcome, was having a baby in the end.
Yeah, I've also had a patient who didn't have a period for a very long time. And then I got an email once on a weekend. It says, Dr. Angela, it happened. I got my period! Exclamation mark.
I can't believe someone would be happy with having a period.
But it's one of those things that only a patient and their doctor can truly understand and celebrate that win
Yeah,
together, isn't it?
yeah, that's it. Must be so rewarding for patient and us as well.
Definitely.
Yeah, that's awesome. That's great. And what are some of the challenges that you find your patients are facing when they're trying to lose weight?
I think one of the main challenges that they have is, first of all, finding someone who will listen and take them
Mm,
seriously. For a
yep.
lot of patients, by the time that they make that first step to book that call with me, I already know that it's taken quite a lot of bravery to get to that point.
Mm,
And I know that they often feel quite uncomfortable, quite vulnerable,
mm,
and it's very, very difficult for them to even make that call because up until that point, they've seen quite a few doctors, some of
mm,
whom who have brushed off their concerns, some of whom who have given them very offhanded advice, like
mm,
it's as easy as eating less and moving more. It's as
that's it.
simple as calories in versus calories
Mm,
out, or even worse, been put down and said, I'm sure you're just eating more than you think. So a lot of patients actually are on the receiving end of quite a
hmm
bit of stigma or judgment or discrimination before they even are able to find a GP who has an
mm,
open mind and experience in weight management. So I
yeah.
think that is the biggest challenge for patients, to be able to find someone who is supportive in the very beginning. Once they get a good relationship with their healthcare provider, I think it's much easier from that point forward.
Absolutely. Yeah, I agree with you. Yeah, I used to tell patients eat less, move more as well, but we know it doesn't work, and it's just very off-putting for our patients.
It's very easy to say, but it doesn't really achieve that much in the end.
Yeah, yeah, because the patients probably tried everything. They try to cut down, and they probably put even more weight on afterwards, up once they've increased their calories.
Yeah.
Yeah, that's great what you're doing. And you're hosting the Australian Weight Loss Summit, which is next week, isn't it?
It's
How
all happened very
exciting.
quickly, hasn't it?
Yeah, yeah. Tell us a bit more about the Australian Weight Loss Summit. I'm so excited
Well,
to be one of the speakers. Thank you for inviting me.
you were actually the first person who I thought of, Dr. Avi, and one of
Uh,
the first people who I reached out to be a panelist. The Australian Weight Loss Summit is something that I have wanted to do for a really, really long time, but never really had the courage to be able to do. So I've been running Enlighten Me since November of 2022, and in
mm,
that time, I've had some experience in running online events, running online weight loss masterclasses, running Facebook Lives, and inviting patients and prospective patients to come and learn about weight management, because I think there is a great lack of evidence-based advice, lots of case studies, and lots of health professionals who are happy to share their
hmm
experience and their expertise for the community. And so what I really wanted to do was, as someone who has a lot of colleagues in the field, as a
mm,
GP who knows
hmm
other GPs with lots of subspecialties in medicine, I know you who have lots of expertise in lifestyle medicine and low carb. I know lots of dietitians, exercise physiologists, psychologists. Why not get everyone together and put on a show and help everyone get access to be able to ask their questions in a really supportive environment? So that's what
hmm
I decided to do. And I decided to call it the Australian Weight Loss Summit, because let's just invite everyone who is open to having the conversation about weight loss. Let's learn about everything when it comes to weight loss. Weight loss doesn't really have to be one of those topics where you only talk about it in whispers, or you only
mm.
talk about it in closed circles. I want weight loss to be something that we shout from the rooftops, or something
Oh,
that we're
great.
quite happy to talk about around the water cooler, where it's quite acceptable. I
Yeah,
really
yeah.
want us to have open conversations when it comes to weight loss. And so we're going to learn all about what are the medical options, what are the medication options, what are the surgical options, how might I start the conversation with my GP, what are the
hmm
lifestyle options, what are the dietary options, how can
hmm
I get started with low carb, what about emotional eating. There are so many things that I think are going to be helpful to the
Yeah.
everyday person, even to
hmm
other healthcare professionals. And so I invite everyone to come and join us for the Australian Weight Loss Summit.
Wow. And it's free. It's amazing. You put it all on for free.
I believe that we should actually have accessible health information. And if
Yeah.
all of these experts are willing to get together and put together some time, I believe we should just invite everyone. Why not? The more the merrier.
Yeah, that's amazing. So tell us about the structure. You've got 3 evenings that you're planned and three panel speakers each evening. That's
That's
how I believe
correct.
it is. Yeah.
So we're doing this over 3 evenings. The first session is on Thursday, the 25th of July. Session
Mm,
2 is on Monday, the 29th of July. And the third session is on Thursday, the 1st of August. Each one will run from 7 to 8:30 p.m. Sydney time. And each session will have 3 panelists. They'll each speak for about 15 minutes on their particular topic. Then we'll get all the panelists together and everyone will be able to type their questions into the Q&A box, and we'll let the panelists all talk amongst each other and answer the questions for you. So everyone will be able to get their questions answered live on the night.
so this is all over Zoom.
All over Zoom, correct?
So I believe I'm on the second night on the Monday.
Yep, that's right. You're on the second night where we're going to have lifestyle approaches to weight loss.
Okay, great. So, What was I gonna? So if people sign up and they can't attend, can they get the recording?
Yes. So as soon as you register, so you head to www.awl for Australian Weight Loss Summit, summit.com.au. That page has lots of information and also a place to put down your details to register your spot. And once you've registered, you can hit reply to the confirmation email with the word replay, and we'll send you a copy of the replay and also your virtual gift bag. So the virtual gift bag has lots of great learning resources such as recipes, such as podcast episodes that the panelists have put together that's going to really help enhance your learning experience and help you to start implementing some of the learning from the night.
That's awesome. Tell us a bit about who are the other speakers. I've sort of looked at the names and I know quite a lot of them.
Yeah, great. So on the first session, we're going to have Dr. Terry Lynn South, who is a GP who has a subspecialty in metabolic health, and she's also dual trained as a dietitian. We also have Dr. Nicole Winter, who is a bariatric surgeon from down in Melbourne. And we also have Alex Papadimitriou, who is a pharmacist from Sydney. So those are the three speakers for session number one. For session number two, we have yourself, who is our low carb GP and lifestyle GP. We also have Dr. Lucy Burns, who is going to be speaking on the topic of menopause. And we also have Chantel Wardini, who is another dual trained. She is a exercise physiologist and a dietitian. And then on session number three, we'll have Dr. Catherine Backus, who is a bariatric GP. And we also have Glenn McIntosh, who is a psychologist, and myself, Dr. Angela Kwong.
Great. All right. Yeah, Dr. Lucy Bird, she's in the low carb space as well. So she would be encouraging low carb.
Fantastic. Yeah, it's always good to have like-minded people. And even when you have people who are from the same subspecialty, sometimes you can also see things from a slightly different perspective as well.
Yeah, how exciting. I can't wait to have the Australian Weight Loss Summit.
Thank you. Thank you so much. And we're
Yeah.
so excited to have you on board.
Oh, thank you, Angela. Thanks for inviting me. And before we started recording, you had something else really exciting that you showed me. You had a new product. Tell us a bit about that.
Yeah, so while I've been looking after patients during their weight loss journey, I've noticed something. A lot of my patients who take weight loss medications tend to struggle with their appetite. So when they're taking their weight loss medications, they tend to only have about 30 to 50% of their appetite. And for the very first time, they do have less food noise. Now, in the past, patients have said, this is great. I have an appetite suppressant. I don't have an appetite. I'll finally be able to diet, to restrict, to cut my calories, and to be able to lose weight. But for the very first time, something different has happened. There's actually been a concern that they're not going to be able to hit their nutritional targets, including their vitamins and minerals, and including their protein. So something that I've been trying to do during their weight loss journey is help them calculate exactly what it is that they need and try to supplement for them. Now, we've tried to supplement for them in a few different ways, such as giving them meat protein, giving them plant-based protein, giving them supplemental protein. But with a lot of the weight loss medications that my patients take, they do get this side effect, which is called delayed gastric emptying. And so for a lot of my patients, getting their protein through meat can be very uncomfortable to digest. So I've been trying to get my patients to have meal replacement shakes to supplement, particularly if they're having less than 50% of their intake, because it allows them to have a source of protein along with the vitamins and minerals. And yet what I've noticed with a lot of the meal replacement shakes on the market is that they tend to have a medium serving of protein, but a high serving of carbohydrate. And this is actually very difficult for patients to lose weight when they have problems such as polycystic ovarian syndrome or insulin resistance, or they're going through menopause, which are the patients that I'm really looking after. I sought to create a product that was high in protein, with a limited amount of carbohydrate. But then I also thought about the types of patients that I'm looking after specifically. And when they have been restricting for such a long time, I realized that they also have a lot of gut issues even before they come to see me. So they already have quite a lot of bloating, a bit of reflux, a bit of an irregular bowel habit. And a lot of research has been showing that this has got to do with a very narrow gut microbiome. So one of the other things that I've included in the shakes is actually all the good stuff to be able to support a patient's nutrition. So what I've included in there have been probiotics, prebiotics, and daily greens. So I've put in broccoli, spinach, and kale. And in order to help support the gut, when a lot of the patients are taking weight loss medications and they have reflux and they have nausea, I've also put in a bit of ginger and peppermint oil in there as well, just to help settle the stomach. And this is what I've come up with, the Enlighten Me shakes.
Great. What about the protein? What sort of protein is that?
It is a whey protein concentrate that I've put inside there.
Okay, great. So you've got chocolate and vanilla flavored?
And a little shaker cup as well.
Oh, wow. Looks beautiful.
Thank you. It's been a long time in the making to get to this point.
That's amazing. I wouldn't have a clue on how to make shakes and protein powders.
I designed it based on my experience with looking after patients, based on my knowledge with looking at a lot of products and analyzing their nutritional panel and having a look at their ingredients, and then also asking patients what it is that they like and what it is that they need. And a lot of patients say to me, I don't like things super sweet. I don't like things that are gritty. I don't like buying things in a really big bag when they expire very quickly and when they get very damp. So a lot of this design has actually come from the patients.
Yeah, and all clean ingredients?
Yes, very clean.
Great.
And no artificial sweeteners.
How do people find this product? Can they order it online or something?
Yes, they'll be able to order it online from my website, which will be opening on the 30th of July. So that website will be www.enlightenme.com.au, and it will also be stocked at selected stockists, which they'll be able to find on the website as well.
Enlightenme.com.au. Okay, we'll share it in the show notes.
Awesome. Thank you.
Fantastic. How exciting, Angela.
Thank you.
So many exciting things happening for you.
Yeah, it's all happening.
It's all happening. Great. So just to round up, can you share with our listeners some practical tips on weight loss?
Yes. I think one of the most important things when it comes to weight loss is to think about whether you have factors contributing to your weight, because often when patients come to see me for weight loss, then they will say, should I just try this or should I just try that? So they'll say, maybe I should be doing 2 days a week exercise, or maybe I should be getting my heart rate above 100, or maybe I should be cutting my calories by 200. So they always come to me in problem solving mode, looking for a solution and coming up with a few different options. But I'll always come up with the same answer for most people, which I can come up with for your listeners. And the answer is that it's very, very important to make sure that you don't have any medical factors that need to be addressed in your weight loss plan. So what a lot of people don't think about is whether they actually have any untreated medical factors, or if they're actually taking some medications that are contributing to weight gain. Because if you have these things that are constantly unaddressed, it doesn't matter how many steps forward that you take, you're always going to have steps going backwards. So it's very, very important to consider all of these things in your weight loss plan rather than just considering that one little step forward that is going to get you an edge. And I can definitely give you a copy for the show notes of my weight loss guide, which is a 10-step questionnaire that helps patients to figure out what are the different factors in their case that could be contributing to their weight.
Yeah, that'll be great, which is why patients should see a GP like you and me to be medically supervised.
Definitely.
Yeah, that's awesome. So how can people find you? Just if they want to lose weight, can they see you Australia-wide or for telehealth?
Yes.
Is that how you operate?
Yes, so patients can see me Australia-wide, but I only see patients who are enrolled in the Enlighten Me program. I don't see patients for pay-as-you-go consultations. They
Mm-hmm.
can learn more on the website, which is www.enlightenme.upliftmed.au, which I'll give to you to pop inside the show notes.
Yeah.
And that will have a lot of resources on the website, such as the weight loss guide, such as a link to our previous weight loss masterclasses where you can see some previous case studies and
Mm-hmm.
also, of course, a couple of past podcasts as well.
Great. That's awesome, Angela. And I would urge all the listeners to sign up to the Australian Weight Loss Summit. It's free. You get to learn lots and then you can watch it afterwards.
Sounds great. Thank you so much, Avi, for having me on the show.
Thank you for coming on Prescribing Lifestyle Podcast, Angela.
Thank you, and I hope I'll see you next time.
Yeah, for all our listeners, thank you for listening. Until next time, we have another guest invited to the podcast. Thank you for listening. Thank you for tuning in to another episode of Prescribing Lifestyle Podcast. Before we wrap up, I have an exciting news to share. I have a new ebook called Low Carb Made Easy. It's now available. This guide is perfect for anyone looking to dive into the low carb lifestyle. Inside, you'll find the basic theory behind low carb eating, a detailed food list, practical meal plan, and a variety of delicious recipes. It's designed to make a journey to better health easier, simpler, and enjoyable. For those who prefer a hard copy, head over to my website and register your interest using the link provided. My website is www.mlcclinic.com.au. Head to online store. Remember, the information shared in this podcast, it's for educational purposes only and not proper medical advice. Always consult your medical professional before making any changes to your lifestyle and diet, or you can come and see me in Melbourne Low Carb Clinic. If you enjoyed this episode, don't forget to subscribe, leave a review, and stay connected with us on social media. Your feedback will help us improve and reach more listeners. Lastly, if you found this episode helpful, please share it with your friends and family. Together, we can make a positive impact to our health and our communities. Thanks again for listening, and as always, stay healthy and happy. Until next time.